Hello, good evening, and happy Saturday to all of you. So actually, we are a little bit today late because of some technical issues. We'll be rectifying those issues in the future podcast, and we'll be right on correct time, 7 p.m. every Saturday. And welcome, Cathy. How are you? How is your
Fine,
days went
welcome,
for the
welcome.
past week?
Yeah, I took leave today. I had some physical issues,
Oh,
so the day went well
mhm.
in home.
Okay, that's great to hear that your day went well, and we would like to spread the same kind of love to each and everyone in the world who are in the nursing fraternity and also in the common people who are seeing this episodes and the podcast for their understanding and their well-being. And each week we are taking some good topics and good relatively the important stuffs we are discussing, and this is how we are. Encouraging our nursing fraternity to develop in India and all over the world. And it is not only about the Indian people; it is also for the nurses who are working in America, Australia, and each and every area. So we are covering it. That's why we are conducting this podcast in a language that is well known to all of us. And we know this episode is the seventh episode. We are happy to say that we passed around six episode, and we love to prolong this episode with the name of 20, 30, and hundreds. And please do subscribe to our channel so that you will be getting a notification for this podcast every Saturday, 7 p.m. And this day, we are going to speak something different from what we spoke on last six episodes. That's a kind of professionalism which we didn't do today for the timing. So this is also related to the professionalism where you need to keep the small changes can change everything. That's a little bit of water. The drop of the water can make everything to change. That's a main code we know from the younger life. But as a nurse, we have one problem. We have a shifts, three shifts in a day. But the thing is, morning we will go by 8 a.m. The sharp 8 a.m. But we will not leave. We will not be left the hospital before 2, or it is not sharply by 2 p.m. So it will be like 4 p.m., 5 p.m. Every nurses in the each and every shift after their duty hours, they prolong their 1 hour, 2 hour, and 3 hour, and they still back in the hospital to see and take care of the patient. The same kind of activity, it is already in our blood, so we are not sticking our time to 7 p.m. We apologize, and this is mostly will not be happen in the future podcast. And happy to say this today's episode is belongs to the topic that is relatively helpful for not only for the nurses, it is for all person each and every day the person into the different jobs, but the jobs may differ, but the professionalism, the kind of the speaking, the communication, where we held up with the discipline, so it will not be changed. So today topic is the professionalism in our nursing and the small habits that make a great nurse, the small changes that can make a nurse to a great and very good layer to get into a very good steps in their life. So that is what we are going to speak today. And Kathy is going to give us habits, the small habits, what we can change in our life, in our nursing life to promote our fraternity very good. And this is not a kind only to know what the habits to be done. This is where we are going to discuss mostly into this professionalism. Thanks for being here, Kathy. And as well, we know we start with the VC's Connect, so where we just engage ourselves to know something between us, as we are the friends, but we want to connect a little bit of professional things. So I want to ask you something. If a professionalism could be described in a one word, what would you prefer to say us?
Okay, maybe it can be honesty or integrity. I can
Okay.
say one word. Since it is one word, I should say integrity. It
Mhm.
includes honesty and it
Okay.
includes accountability also.
Mhm.
So
Yes.
one word
So
answer.
okay, one word. Anyway, so it is not going to be described within a one word. There are many things out there. but the mostly we need to think about the stuffs which we can change in our professionalism. Right, we will be going to the next VC's connect point. What's one professional habit you consciously developed over these years of your experience?
Okay. Maybe confidentiality. Like as a student
Confident.
nurse, I used to discuss everything with
Hmm.
my colleagues, my friends, like my
Yeah.
batchmates, or with my friends who are not with me in that batch. I used to discuss about
Hmm.
patients and everything. So
Hmm.
as gradually I'm growing up, confidentiality is becoming part and parcel. Like I'm strictly
Yes.
maintaining confidentiality, be it in a clinical setting or now I'm in teaching. So confidentiality
Hmm.
about my students, whatever they speak or ventilate with me, everything.
Yeah.
So one habit I had developed very consistently is confidentiality. Maybe another thing is reflecting, like
Okay.
reflecting my day. What happened good,
Hmm.
what happened bad, like where I missed my professionalism today. So reflecting on my habits, day-to-day life incidents, I that is one thing which would make my professionalism more better.
Yeah, yes, you said rightly, Kathy. So it is not only how we are maintaining our professionalism, it is also the part how we are maintaining the data of the patient and what our friends told to us and what our faculties told to us. The confidentiality, it's a biggest discipline where each and everyone can't follow it. Why? Because we know we are the speakers, we speak to somebody else and we will reveal something. It is not about that entirely we are going to reveal to someone. It is like a little bit of point we will be telling to them. It will be like spreading across the each and every area. So I said, so the privacy, the maintaining of the privacy data of the patient includes the confidentiality. It is should not be spoken in a lift. It should not be spoken in the stairs. So that is kind of a thing we forgot. What we will do is from ER to a ward, we will discuss about the patient condition to our friend, and we will disclose everything to the person who are attending in the lift, even though. So that kind nowadays the accreditation policies has changed, and many these kind of the flexes has been put on all over the hospitals to maintain the confidentiality, the privacy data of the patient, even though it will take some more decade to change this kind of thing. Why? Because now only we are developing our community in the standard and the quality development. So that's right about the
I would like to
confidential.
add something. When it comes
Yeah.
to teaching sector, I should actually give examples to my students regarding how it
Mm.
will be like everything. So in
Yes.
that time, the confidentiality I maintain is the patient's demographic data. Like I have to
Mm.
explain, like we had a patient like this. I can explain so that the student gets more enlightenment about the condition if I tell my real life experience, but I should maintain the confidentiality of the gender of the person, like other personal details like name or age,
Yes. Yeah.
which hospital I saw the patient. Those things can
Yeah.
be like the diagnosis. If I'm telling the diagnosis, I'm not going to tell what exactly the patient is like. Oh, maybe the particular signs and symptoms, how I managed. Those things can be. I might discuss with my patient,
Yes.
especially being in psychiatric specialty. I have to tell, I have to teach examples to my patients, to my students,
Yes.
sorry. So in that time, maybe the personal details of the patients should be maintained confidentially. So that is what I developed. I won't reveal the
Yes.
patient's name or which ward I saw the patient or anywhere.
Mm.
Maybe even which hospital, like where all I went posting.
Mm.
I won't say that. Maybe I will just say, like so and so patient was there. I used to particularly mention Mr. X, Miss X, like that. So that is the
Mm.
thing.
Yes, yes, of course. When we create scenarios, also, Kathy, for the simulation setup, we would like to keep the same kind of thing from the case file. But the problem is, if I disclose that, yeah, Mr. VC has this kind of problem and he has some kind of surgeries underwent. So this what happens is whenever that name indicates, it is not only I'm just revealing the patient name, it is also that somebody in the group of the simulation, that students will think, okay, this can be related to my friend. So they will be teasing their friend, yeah, see that your name is also Nandakumar, and the patient name is
Ah,
also
yes.
Nandakumar, and they will say this kind of thing. So this happens in the kind of the student period also. But the maintenance of these things to be happen day by day, and they can change it little bit as possible, how they can do it. And I want to understand one more thing, Kathy. Why is it more than just appearance and following the rules? So why? Because when we say as professionalism, they can mean like I need to put a tie here, I need to tuck in my shirt, I should not wear a t-shirt, I should not wear a bracelet. So there are many kind of rules are there, so I need to know whether it is just a kind of the appearance, or I need to follow some rules to showcase that VC is very professional to my patient, or VC is very professional to my students. Why? Because nowadays you can see that there are many cases coming out, the kind of the POSCO the thing, or a kind of the abuse for the students by the male faculty, or from the female faculty to the male students. So now it is very common. If anything has happened, if I scold my student, what happened? She or he will be thinking, okay, let me show how hard it is, and they are telling that he has abused, and he has this kind of the harassment has been done to me. So this can be a lie, and this can be a kind of the truth also. But the following the rules sometimes end up in some different pathway, right, Kathy? So I need to know whether this is kind of the following the rules, or I need to change something else better.
Actually, it is not just appearance. Appearance doesn't
Mm.
like I can't say appearance will not maintain a professionalism, but
Yeah.
it just contributes a very little or the least amount to professionalism, because we
Okay.
also have a saying, don't judge a book by its cover. Being
Yes.
professionally fit, like as you said, wearing tie, tucking in, those things we
Mhm.
instruct our students, clean shave panning, we ask
Yeah.
clean shave, hair, properly trimmed hair, and proper
Mhm.
put-ups. We say everything, but that is just to have a appealing, appetizing to our eyes. The patient must not.
Mhm.
If we go and stand shabby under the sorry near a patient, we won't. The patient
Mhm.
won't be having the trust with us. So the appearance
Yes.
just contributes some a very least to the professionalism. But actually it is not only the appearance, because
Mhm.
for example, nurses can be professionally very well groomed, with proper neat uniform, ironed uniform, and properly tucked hairs, and with clean hands, without any nails, everything. But the way they
Mhm.
communicate with the patient, the way, if a nurse is having empathy and another nurse is not having empathy, what's the use of being professional in your looks, in your appearance? And one
Yes.
more thing is, my appearance is not going to affect my work.
Yeah.
There are many rules, like following rules. For example, for teaching, we are asked to wear saris. But there are still institutions where we can wear chudidars for teaching. So professionalism is not about dressing or anything else. It is about the stuff
Yes.
we carry. So I totally disagree that professionalism is totally on dressing sense or the appearance.
Appearance.
It
Mhm.
contributes, but not to the most part. It is the least part of
Okay.
contribution. The most contribution is the stuff which we have. For example, the
Mhm.
empathetical feeling, the emotional resilience, or the confidentiality, the honesty, the communication with the patients. Those are the things which will make you more professional than just following the rules and having a good professional appearance. Maybe I might not follow
Okay.
the rules, I might not follow the dress code, but I would be very professional in my teaching. My teaching might be very professional. So
Mhm.
my dressing sense has nothing to do with my teaching, way of teaching, or the way of care I give to my patient. So that is. But
Yes.
still, we have to have a proper dress quote, so that we look appetizing to the patient. The patient should have the first impression when they see us, they should get something, right? So for that,
Yes.
for that perspective, this will contribute. Other than that,
Okay.
nothing more.
Okay, this is the kind of the factor that contributes. It is not only the 100% why you look with a clean shave and you put a put up and you dress well like a nurse and you enter to the the patient area and you speak shabby or something not related to medical care or the procedure. So that also relates to that, and this is a kind of the part, the appearance. So even though it contributes something like 20 to 30 percentage in each and every life. So I want to know that if I do some kind of the professionalism, whether that influence my patient trust that okay, if VC comes to my cabin or VC enters into my room, so he looks very professional, so I can share anything to him. I can share I didn't I forgot about the tablet in the last night. Maybe the another nurse who is not maintaining professionalism, so she is having a barrier to say yeah, I didn't take a tablet last night. So what kind of the thing it is having the difference, and how the patient trusts us, the kind of the professionalism or anything else?
Of course, professionalism plays a very major role in
Mm.
building trust, because professionalism is just a word, but it comprises of very more lot of things. Like, for example, first thing I would like to mention is communication, because we have to be very professional in our communication.
Yes.
Using of local terms or any other vulgar words doesn't make us good professionals. So,
Yes.
first part I would like to concentrate is on my communication, the way I communicate with my
Mhm.
colleagues, or the way I communicate with the patient, or the way I communicate with my students, or the way I communicate with the patient's attendant. So, professionalism starts in communication, because how I greet and how I respect them plays the strong foundation for the trust which is going to be
Mm.
built. So
Yes.
first thing
Yes.
I would like to say is communication, proper communication, and that communication includes being honest. Like, instead of giving
Mhm.
false assurance or false reassurance, I should be very honest in my part, what I am doing, and I should
Mhm.
include the patient in their, like, I should also give autonomy to the patient in decision making for their treatment.
Yes.
So including my patient in their care, in respecting their decisions, and giving a very
Mhm.
dignified care, automatically builds the trust of the patient. Okay, this nurse will not do anything without asking me. She will
Yes.
always ask my consent before proceeding with any procedure or anything
Mhm.
of their choice. So that is the way how I'll build trust. First one is being honest with my communication, and always
Mhm.
including patient in their treatment, like including their decision making, like respecting their autonomy, and also being
Mhm.
accountable for my actions. Like, sometimes there are nurses who tell, like, I didn't ask you to do that. The patient might
Yeah.
have done that upon the nurse's instruction, but suddenly, when the
Mhm.
nurses realize it is wrong, they might just tell that I didn't ask you to do that. Why are
Yeah,
you
we understand the
saying like so?
honesty. Yes.
Blame language, blaming someone else is not actually
Mhm.
professionalism. So, if you blame the patient, even automatically the patient will not develop a trust in you. It is not
Yes.
only for patient; it is for anyone else. If you start blaming someone
Mm.
else for your action, if you're not taking accountability, then automatically trust deteriorates down there. So that is one thing
Yeah.
how you build trust. So proper communication and
Mm.
decision making autonomy should be given to the patients, if it is for patients, and a proper as I said at the last part, taking accountable being accountability for your action builds the trust for a patient. Or in teaching side, it is like I'm building trust with the student is like, if he shares anything, if he or she shares anything regarding his personal things or his family sufferings or his mental health, There are students who ask counseling to me. Many students are there, but I don't discuss it with my colleagues or even sometimes with their class teacher. Like one of your students approached me, so if it is academic part, I would just tell like we had a student coming to us for counseling like this. So and so, we won't. Most probably, we won't. I never reveal the name of the student. We just give a common instruction. So these are the academic lacunae they are facing, like these are the problems they are facing, so that you can rectify it. So these are the things which we say. We never say the name of the student or anything. So that trust comes to the student. There are many students who come and they speak with me just
Yes.
because of the trust what I gave. So that trust doesn't come all of a sudden. It is
Mm.
gradually built with our communication, like keeping up with our promises, feeling empathy for them, being accountable for our actions, and proper follow up. If we just give medicines and we go to the next patient, we have to follow up with
Mm.
the patient. Like, I gave you medicines, is the pain reduced or not? Following up
Yes.
with the patient builds trust. So this is how we build trust with the patient.
Okay. You absolutely you said the right example between faculty and the student. Now, as you're from a mental health nursing, the most of the student will come to you and say, "Ma'am, I have this kind of issue in my family. Ma'am, I have a boyfriend, but he is not working good with me, and there is some kind of problem is going with me, and I have some health issues. For example, maybe some kind of STI, something maybe. So what happens here is the trust how students are keeping on the faculty is the day when something is said to the faculty and she's coming to the classroom and she's maintaining a confidentiality of mind is a habit. So there the discipline increase. The students also will think, okay, in future I also need to maintain confidentiality of anything else. If the same faculty comes to the classroom and she reveals or she teases something like, okay, you said like this and this was happened, to make the classroom as a good environment or to the happiest most environment, she or he would tease the a student onto the same matter. So this happened in many colleges. The same that also seen in the patient side. The patient confidentiality and building a bond between a nurse and patient is very much important. Nowadays, we see many films and the series, web series are coming into the OTT and the theaters. So what these pictures are representing the nurse as a violent, aggressive behavior, but this is not the most of the nurses are. So there are only 10 percentage of the nurses. For example, you can take like a policeman. It is not like many policemen are involving into the corruptions. There are only 1% or 2% of the policemen are taking this kind of bribe. And what kind of this thing happens is the 100% of the police are doing the same. So it is like we are blaming the entire police community. The same is happening to our nursing thing. When you go to some hospital, the nurse is not eligible for some kind of communication, but she is literally dealing with a patient who is having anxiety, depression, or kind of the stress, and she come in, enter into the hospital. Then you are shouting at the patient. What happens is the 1% of the nurses who is doing in any corner of the country, what happened, the entire nursing has spoiled their name. So this is what happens it. And the building the trust is very important with the patient. Then only patient will open a mouth and she will say, he will say to a nurse, okay, this was happened to me. Or else there will be a kind of a white cloth between the sheet, it will be between the nurse and the patient. So that is why this is very important. I need to know whether the professionalism is coming from the childhood or the kind of I can study in some kind of the normal school, and I bought up with a college which is not up to the mark, but they teaches only the nursing to me. There is no any kind of experience of how to behave with a patient or how I need to behave with somebody else. But I enter into a nursing field as a staff nurse or the nursing officer. Do I get this kind of professionalism from the experience, or suddenly it will come? What happens with this? How I can develop my thing, or else I can learn, or it will be coming through experience?
Okay, it is from both. Like,
Mm,
you might say it is not only from the college. Professionalism, like every student, one day or other, he will be entering some profession, any profession. So, professionalism starts from the school, like being punctual, being on
mhm,
time,
mm.
uh,
Yes.
to school even is professionalism. Okay, so it should start
Yeah.
from the schooling, and then in college we learn. In nursing education we have a separate course, like subject called professionalism in fourth
Mhm.
semester.
Yeah.
Second year, fourth semester, we have professionalism, and there we learn. What we learn is something theoretical. We learn about ethics, we learn about communication, what are the legal problems will be a nurse will be
Mhm.
facing. We learn about ethical dilemmas, ethical decision making. So we just learn as a theory, but practice will be in the student only when he enters the clinical setting. So it is both, where he will learn professionalism in his college years also, and also as he continues his journey as a nurse in a clinical setting, professionalism will be developing. Professionalism doesn't end anywhere. It is lifelong journey. As we say now, education is not a one stop point. It continues till our
Yes.
death. We learn new things. Every day we learn new things. So,
Mhm.
likewise, professionalism is a very, it is a lifelong journey. We learn every day from our mistakes. We learn professionalism from each and every action of ours. Like ethical decision making we study as theory in professionalism subject, but the practice
Mhm.
comes at a clinical setting. Being empathetical is which we develop in a clinical setting, and emotional resilience, we just know the definition of emotional resilience as a as a nursing student. Emotional resilience, what we develop totally within us, is only in a clinical setting. And
Yes.
we learn communication, how to communicate, the techniques of communication as a theory, but we put it in practice only when we go enter a clinical setting. So as a student period, certain professional habits like being punctual, being on time, following some ethical rules as a student we do, but something like emotional resilience, being accountable, and those things can be developed only as a staff nurse. And as years progress, you will be mastering those things.
Yes, yes, of course, Kathy. Like this kind of thing, it doesn't happen in a single day. And what I
Yes,
learned from my YouTube channel, or maybe the kind of this podcast, a nurse is entering into this podcast and she is or he is seeing this podcast, immediately nobody can change. This is where when you get up from the bed and you fold your own bed sheet and you clean your bed, from that the small change happens. So this is how the professionalism may be built from childhood. It is not only the environment teaches us. This is also from our family, the father and mother, or our siblings. Maybe how we are seeing our television, what are the pictures we are. The many kind of factors it is going to influence us in the professionalism. Yes.
that's what
So
I told. It starts from the schooling. It doesn't start
yes.
all of a sudden once I enter a clinical setting as a nurse. It starts from school, then in college, and then in practice.
Yes, of course. We learned many things theoretically, but when we go into the ward or ICU in the hospital, that time we will be literally. It is very difficult to adapt to that situation along with this professionalism. But nowadays, the nurses are inbuilting themselves into this kind of professional works along with the multidisciplinary team. So that I would like to share the same also. Nowadays, it is not only a single nurse is working, it is a teamwork where we are protecting our patient from the kind of the fatal things. And how what habits makes a nurse stand out professionally? How if I come into the room, what happens is, or something is going to be judged priorly. What how I can stand out?
First one is being punctual. As you mentioned earlier in our conversation, we enter the ward 8 o'clock, but we are not leaving at 2 sharp. Like there, even I wanted to correct. We don't enter the ward straight at 8 o'clock. We enter 7:45 or 7:40. Okay.
Yeah, yes.
So being punctual is the one most important habit a nurse can. Okay. Like sometimes we might be very relieved as when I was working in my ward setting, I was very relieved by one name. If I see like I have to hand over my patient to that particular nurse, I'll be very happy because she used to come very early. So I need not
Okay.
wait more than my shift hours. So that is where first they stand out, being punctual. The next one
Okay,
is
great.
like being prepared. Like if I allot something, if I give the work to someone, this nurse, she'll be always prepared for that. Like preparedness is not only for emergency situation, it is for everything. Like a critical thinking or cultural competence, dealing with patients with cultural competence. We have as a nurse an all-rounder. I should be an all-rounder. I should be an advocate. I should be an educator. I should be like what a, a major bridge between the patient and family member. So preparedness for everything. Preparedness doesn't mean only for emergency situation. For anything on everything, preparedness. Like if this nurse comes, the problem will be sorted out. She has
Yeah,
solution for everything. So that is
yeah.
where we that the nurse is made to stand out. The next one habit is proper communication. I would like to specify more about assertive communication. Even the way we say no should not hurt others. So, being aggressive or passive aggressive in our communication, passive communications will not work here. Assertive communication and a polite conversation is where we stand at. Okay, even at storm, the this nurse will be very calm, like she will not match our energy and she will not shout at us. So that is where
Yeah.
okay, this nurse is always calm. We can never see her angry. So that is one a particular habit or behavior a nurse should develop in her, being calm and quiet and assertive, being assertive in our communication. And then respect is very essential, because only when you respect others, people will respect you back. Or else,
Yes.
okay, that nurse, she doesn't even know respect. Why communicating with her? Why telling with her? People will avoid communications with her. That is where we might, we might lose something. We might not get any orders like communication. We might not get any information regarding the patient. Okay, she always shouts at her. Why should I tell that to her? Or she doesn't even respect what I say. Why should I share the information with her? So once I lack information, automatically my care competence will become low. So respect is one other main thing what I should like. Not only I, everyone should develop, like being punctual, being prepared, proper and effective communication, that is assertive communication, and respecting. And then accountability and teamwork, I would add on. Accountability is never deny your mistakes or never blame others for your mistakes. And then teamwork. Teamwork is very, very essential part of professionalism, because only you as a nurse cannot handle a patient. You need all other support. Even the patient support you should have to give care. Only when the patient cooperates, you can give the medicine. For a conscious patient, only when the patient cooperates with you, you can do all the procedure or give medicines or giving care. So proper teamwork doesn't mean only with the healthcare professional. It includes the patient and the patient family members. So I would like to say these habits will create a good professional nurse. You
Okay.
want to add something
So,
else?
yeah, there are many things to add when it comes to the professionalism. But I need to ask one more thing to you. As you mentioned, the angry and anger mode. This is not only with 10 percentage of the population. It is 100 percentage in our population. Each and everyone gets into the angry mode. So I want to understand whether that is kind of the disagreements. For example, I would like to say this podcast can be by 8 p.m. and you say like no, no, it will not work. It will be a 7 p.m. How these kind of disagreements, how a nurse can handle. This is between a human being. This is between something for the podcast. When it comes to the life-saving situation in front of the patient, these kind of disagreements creates a mini problem. How do you see about these things?
Of course, disagreements are always evitable. Like we have disagreements, not only as a nurse, we have disagreements with our parents, we have disagreements with our partners. For
Yeah.
everyone, not always we go in terms with them. So there are a few
Mm.
points where we have different opinions or something. So first thing I would like to say is staying calm. Like when you have a disagreement, instead of arguing with that person, first stay calm, then you
Mm.
make them the second thing is listen before acting. Like uh, don't judge, don't have a prejudgmental work. Like always there are certain people's whatever that particular nurse says will be wrong, so they
Mm.
will have a
Yeah.
disagreement automatically. So even
Yeah.
when they are coming to tell something very critical or important to us, what she always says mistakes. She always gives wrong information. So that particular prejudgment should not be there. That is where disagreements occur most of the time. So
Yes.
always proper listening will reduce this disagreements. The next thing is focus on the issue, because disagreements will lead. It is not. It will give you personal conflicts, but it affects the patient care. Right. If
Mm-hmm.
we have disagreement with the treatment of choice, with a medication, or with some values, it totally affects the patient's care. So I should focus on the issue, not on my personal conflict. So that is where many people may make mistakes. Like who is he or who is she to give me orders? Like
Yeah.
for example, if a doctor just mentions a wrong dose to the patient, a nurse is pointing it out, there might be a disagreement. I am a doctor, I am a physician, I can't be wrong in that. So that
Mm-hmm.
is the a disagreement. So that point, a nurse should not argue with the doctor, or the disagreement should not be pointed out like you are wrong, so your dose of medication is wrong. Like instead,
Yes.
we can give like a suggestive feedback where, sir, I think you have given a very high dose for the recommended patient, or
Mm-hmm.
maybe you might not the proper weight. Sometimes weight calculations will be there for dosage. So
Yeah.
the
Yeah.
weight of the patient is so and so. Is this dose okay for that patient? Like that, we should ask suggestive questions instead of
Mm.
just abruptly saying no, you're wrong. So that is
Yes.
one point where we can settle disagreements. Next is communicate with courtesy and empathy, because the opposite person is also a human. Uh,
Yeah.
Machines make mistakes and human make mistakes. Humans,
Mm.
there are possibilities for error. So just without any courtesy, do not speak at their face. Empathetically, just point it out that there is a mistake in your values. Is there anything you can do to second check it? Those things can help a person deal with disagreements. The fifth thing is willing to accept feedback. Like if someone, I'm pointing from the beginning, pointing out to someone who is disagreed with us, or we have
Mm.
disagreement, so someone else has disagreement with us. First thing we should is we should able to accept the feedback what they are giving, like escalate the concerns appropriately. Like okay, you are saying I'm wrong, I accept it, but can you give me more clarification where I went wrong, so that I could make it correct the next time. So
Mm.
speaking with that polite work always, and getting feedback for disagreements is like once we correct our mistakes, the next time we won't repeat it. So disagreement
Yes.
from our part, if we are pointing on someone else, we have to stay calm, listen actively before pointing out. We have to give suggestive choices instead of pointing out in an aggressive way. So if someone else has disagreement with us, accept the feedback and correct it again for the next time. Just please don't ignore, because at last it is the patient who is going to suffer with your disagreement, not you. And
Mm.
moreover, if you have disagreement with the person, uh, it is only for that particular incident. Do not carry that baggage for the next day or for the next shift or for your prolonged term. There are many people like working with a lot of people. Like
Mm.
sometimes we have disagreements, and when we point it out, uh, automatically for the next 3 days or the whole week, they are not in connect with us. They don't
Yeah.
speak with us. Any information what they give comes through some third party. So
Mm.
that is
Yeah.
that sometimes the third party might not convey the information properly, right?
Yes.
So that I
Yes.
used to feel very childish when this happens. Maybe sometimes I would have done that, but when I
Mm.
think of it now, in this time at this age at 29 years old, like I feel it is very very pathetic to her. After a disagreement, we are not connecting with that person, so that should be avoided because that will further lead into a big gap, which is not
Mm.
the gap between you and the person. It is the gap between the treatment and the patient care.
Yes.
If it is a
Absolutely.
teacher, it
Yes.
is between my teaching and the student learning activity. So that is what I need to tell about this disagreement.
So nowadays, many people are literally they behave like a child. Why? Because from the childhood they do the same in their school, college, and now it's carried forward to the working area also. Anyway, it might be changed once they face the same thing to them. When somebody do the same thing, that okay, I should not speak directly to him or her. So what happens that then they will realize, okay, fine. So I did the same thing and I need to change now. So that's a very how we say like whatever you do, the cycle will come down and it will
Yes,
go
karma is
up
a
and
boomerang.
down. Yeah, yes. So we should not think that okay, it is only for them, it is also for this also. And I need to think one more thing point is usually what happens for junior nurses, it is not only for the junior nurses happens. As a human being, I can do some mistakes knowingly and unknowingly, but for in front of the patient, no nurses will think okay, I need to do this mistake directly to my patient. So this kind of how I can overcome myself if I'm just directly involving into this, but that mistake it is unknown to me, unknowingly I did this thing. So how they can overcome this one?
First, you have to accept your mistakes. That is what I
Mm.
always say, being accountable for your mistakes. Because only when you're
Yeah.
accountable and when you properly open up the mistake, the patient can be treated further. So being
Yeah.
accountable and accepting the mistake is one way, and properly documenting. Like some might say it was my mistake, fall happened and everything, but they won't document the proper timing because they might feel like okay, you the recognition time of the fall and the period of fall has a very long gap. They might scold. What were you doing for half an hour without checking on the patient? So
Yes.
proper documentation should be there for any mistakes or something. And
Mm.
further, you have to always give clear explanations on why you did that, how you did that. So, and finally, you have to have a reflection like uh, what made you go wrong that time. Maybe
Mm.
sometimes you might be disturbed, or you would have overpopulated, like you are with 10 patients or 15 patients, the ratio of nurse patient ratio. So you should have a reflective why this error happened. As a junior
Mm.
nurse, this is the first thing. Once the error happened, first thing is you should accept, should give proper explanation. You should always never hide things. Even if you accept, there are particular persons, there are persons who hide the they just give an overview of what happened. They won't give clear
Yes.
information. They won't say the exact timing on what happened and everything. So
Mm.
those things should be avoided. And the next thing is reflecting why I went wrong, what made me go wrong at that time. So as a junior nurse, once I ask questioning is where we learn. As we say sometimes, researchers were asking all the questions, why we are doing, what we are doing, how we are doing, to whom we are doing. So as a
Mm,
junior nurse, I should always ask such questions like why I went wrong, what was the reason, whether it was my part or it was from someone else, was the
mm,
part of the patients. Like sometimes we used to instruct on and off to the patient, please don't do that, please don't do that, but they won't ask, like they won't listen to us. We will always say, when you want to go to washroom, please press the call bell, but they won't listen to us. They will always
yeah.
go on their own. So
Mm,
that is where okay, to make that correct, what I should do, maybe I should always check him on his room frequently,
mm,
whether you know to go need to go to washroom, shall I accompany you. So if I check on him frequently, automatically, even if he doesn't presses the call bell, I would prevent that patient from fall. So that is where, if the
mm,
patient is not cooperating, then I will further refine my way of working, how I will make sure the patient doesn't go to washroom separately.
mm.
So this is how I
Yeah.
can rectify from preventing further errors the next time. So as a
Okay.
junior nurse, you asked how to prevent errors, right? So this would be
Yes.
the very apt example and answer.
Okay, okay. So we spoke about this social media kind of pictures or any kind of OTT platforms. They release some documentary. This may what kind of the influence that happened into a nursing community. So sometimes what they will think is, okay, a nurse is a person who comes and who cleans our shit. That's it. Happens for the nurses. And some people think, okay, nurses, we can give money to them and they will give the data to us. Or else, if I give money to the nurse and she will let me into the patient room for 1 hour or 2 hour. So these kind of the mistakes happens. But what the main thing is, this is going to project the entire community of nursing. The one more thing, nowadays the people, some people says that, okay, the female nurse and the male doctor are together in a nurses station, maybe something can be happen. So what happens is the entire thing which is telecasted in the social media, or if you see some kind of serials which is coming in the popular tvs televisions, and now you can see there is a movie that came into our in India. Basically, it is from the Kangana Ranaut. So she did a very good job onto the particular movie, but it was not projected properly. If something it is very negative, it is coming into the society and it is saying that, okay, nurses are doing these things wrong. When we do something rightly, correctly, perfectly, ethically, but it is not coming to our society, that it is not directly influencing the good path things. So, what do you think that whether this influence and that affects our nursing profession?
Actually, coming to this point, like this is not this accusations what you kept are not only now blooming nowadays because of social media. It has been age-old accusations for a long time. For decades, we are having the same accusations, but maybe due to social media, some accusations are fading off. I would thank social media, but sometimes
Yeah.
social media use of a nurse is like you can't tell whether it is for bad or good, because as a coin has both the sides, it has positives and it also has negatives. For example, like sharing about experience, like such thing happen, like instead of showing the patient, like just sharing the experiences, so such thing happens. So if someone happen, if you see someone happening so in any road or something, like basic CPR thing, if a nurse is educating in a social media, that is of good, that has a very
Mm,
positive thing. But showing patients and doing reels with the patients, or taking reels of what your of your work, like my shift as a nurse, like so thing, like you should not include your professional area in social media, because Like you can from the entrance you are covering the reel, but you should not show your ward setup, because uh, there are a lot of things lacunae in each and every hospital. They will start digging. The public will start digging. What is the people will not see your image, your figure,
Yes.
or what
Yes.
you are doing. They always notice the background things, where to find fault, what is the loophole in that video. So
Yeah.
it
Yes.
automatically shatters the image of the hospital, the reputation of the hospital where you work. So it doesn't affect your image straightly. It affects the reputation of your hospital. You when you
Yeah.
especially wear the ID card. Sometimes some government nurses, they feel very proud to do reels wearing their ID card, like AIMS, JIPMER, everything. But
Yeah.
sometimes it feels happy to see such reels, because they do it for a good, like sometimes they give good informations, or
Motivation.
share good informations, or a good like what to tell, uh, they speak about teamwork in some videos. So those things are good, but speaking about showing the infrastructure of the hospital, or showing the care you're giving to the patient, how you are speaking with the patient, certain hospitals does it for their publicity. Like they
Mm.
go, they shoot it properly, and they do it like how we care to the patient, how our nurse talks. But
Yes.
as a social media influencer, when you do that, you are into a point where sometimes there are chances for the institution to terminate you from the work.
Yes.
So everyone will not take everything seriously. Okay, even if you are a very big influencer for the institution, you are just like someone who uses them. So they won't
Yes.
allow that. So that is where they have a very bad opinion. It is not only nurses who does that. Doctors do,
Mm.
lab technicians do, dialysis technicians do, dietitians do,
Mm.
everyone, they are just vlogging their day, personal days. Like one day as a nurse, my night shift, my 24-hour shift interns are doing like 72 hours duty after a long OT. So you show everything outside the hospital, whatever happens to you. But why are you showing this? What is happening inside? Automatically, you are giving some evidences to public. Sometimes, even if that was not your fault, sometimes if for example, if a nurse is a very good social media influencer, she keeps on posting reels with her patients of giving injection and everything. Something happens to her patient, the patient who is taking whom she is taking care of, something happens, what
Mm.
will be the first blame? In the making
Particular
reels, she
hospital.
made that mistake, right?
Yes.
In that concentration, she left the patient. So automatically you are always kept in a point to be judged, or to be pointed for. Even if it was not your mistake, it will automatically come on you only. She is
Yes.
not
Yes.
concentrating on patient care. That is why such things happen. So this
Mm.
is how social media, projecting yourself in social media will almost sometimes it destroys your career, or sometimes it is very harm for your future, everything. But I
Mm.
won't say you should not use social media. You like even this is social media, what we are speaking is gonna not harm anyone. We are
Yeah.
just speaking about, we are just having concerns about certain topics. We are just giving knowledge. So doing such things is
Mm.
not harmful at all. But projecting patients, you are automatically violating patients confidentiality, violating patients privacy. That is not at all
That's
professionalism, right?
against the
Professionalism
human
is what
rights.
basically
Yeah.
you have some ethics, accountability, privacy, providing like maintaining confidentiality, everything. So automatically when you do such reels or on social media, you're violating the rules, or you're not being professional enough, you're not fit to be in that profession.
Mhm. Yeah. Yes, you said rightly about many things, Kathy, and we discussed more point regarding the professionalism. I need some practical advice from you. Three kind of the practical advice I need. The first is the three habits every nurse should practice daily.
Three habits every nurse should practice daily is like, as I said initially, it is like making reflecting on their daily habits. Like as I said, for a junior nurse, I said right, reflecting. Next is communicating properly, and third thing is continuing learning. Continuing education is very,
Yes.
very, very essential.
Yes.
Because though you are empathetic, though you communicate properly, if you don't know the stuff, people will not respect you.
Yes.
Automatically, they won't trust you. To build the trust, you should have knowledge.
Yes.
So these things
Absolutely.
like
So.
proper communication and empathy, continuing learning and reflecting on your actions daily will help you be a better
Mhm.
professional nurse. Nurse as a
Okay.
professional.
Yes, yes, of course. What you said is we need to follow it in the daily, day-to-day activities, or else it is very difficult for us to maintain a professionalism in our profession. So, as we said, nurse, as you said rightly, nurse as a profession, we studied from our first semester, first year, but even though we couldn't understand what and how we need to be professional. And I need one more thing from you, Kathy, and how I should not compromise something. Okay, like something like three professional values that I should never compromise in my life.
Okay, you should not compromise with your compassion, for giving
Okay.
patient care, and you should never compromise with the patient's treatment. That should be your
Mm.
first priority. Priority should never be compromised for anything, any sort of your personal reasons or anything. Once you are in that shift,
Mhm.
you should never compromise for those things, like prioritizing
Yeah.
patient's care, being honest, and like being accountable for your actions. Those things should not be
Mhm.
compromised.
Okay. So, one more thing I need to ask before I enter into the hospital, I am as a student nurse. What are the kind of activities or what are the kind of professionalism I need to get before I get graduated?
First thing, as I said, being punctual,
Mm.
developing your communication skills, and like you have to groom yourself professionally, not
Mm.
only appearance, also have a proper knowledge. Before entering a ward, you should have knowledge on which ward you are, like what type of
Yes.
patients you will be encountering. So like always being prepared. As a student nurse, you should get prepared for your clinical experience. And as it is like maintaining confidentiality is one of the
Mm.
thing, and giving autonomy to the patients. You should always develop this habit. A
Mm.
student nurse, when they graduate as a nurse, they might feel like they have got some superpowers. They can do anything and everything they want in a ward. Like
Yes.
since as a
Yes.
student nurse, some practices or some things would have been restricted to them, so they might
Yeah.
feel. But you should not always like poke into the autonomy of the patient. Like you have to
Mhm.
give the decision making capacity to the patient. So you should not choose, or you should not make decisions for the patient. That one thing they should learn and practice before entering a nurse as a hospital as a nurse. And next thing is working with team. Though in student nurse period they are posted with batches, they do research as a team. Some
Yes.
students doesn't have the teamwork. They always have a safe side for them. Or even if it is a group project, allot me what I should do, I will do that. And apart from that, they will never contribute to anything. For even 0.1%, they won't give their contribution. My part I
Yes.
have completed, that's all. So I do
Mhm.
like that is not actually teamwork. So this thing should be still. I see many people. This was the work assigned to me. I won't do anything more than that. So when someone is
Okay.
saying like that, I literally feel like, what kind of professionalism is this? Not helping someone who is
Yes.
in need, even when you are very
Yeah. Yeah.
free. So that is not professionalism. So that should be developed as a student nurse before entering uh,
Mhm.
a ward as a staff nurse.
Yes, yes, rightly said, Kathy. So when we are in the kind of the student period, so we exposed to the hospital, the clinical setup and clinical area to practice our nursing. So it is not only the nursing we need to practice, it is also we need to know how we need to sit, how I need to communicate with my patient. I should not eat in front of the patient. I should not make my ward or ICU clumsy. I should maintain the register properly. I need to give a medication to my patient sharply and correctly, and I need to maintain the patient rights. And I how I need to communicate with my patient, the conversation level. Maybe I'm coming from a normal setup or from a normal area, but I need to know how I am just putting my words. It is not that you are not putting the vulgar words. It is also how you communicate properly to the patient. So this is the period the student nurse can explore to everything and can understand. Okay, I can do this. I should not do this. Okay, so and we get an internship also at the end of our year. So where these will mold up in the student life itself, and we come back to the hospital where we work as a nursing officer or the staff nurse, and we follow the same what we did it in our student period. So this is also an period, the golden period where we learn many things. And when you enter into the hospital, you can't learn every kind of local collar things. It is only the nursing you will learn that. But other than to that, what you got from your childhood and what you got and what you learned from your student period in college. And now we are stepping into our final
I
thing,
would like to
Kathy.
add something like nowadays student
Yes,
nurses use a lot of mobile phones. So before entering as a staff nurse, they should know to limit their mobile phone usage in ward
yes,
setting during patient care. And sometimes they do incomplete documentations. Those things all should be avoided. They should know how proper
yeah,
documentation should
yeah,
be done. As a student nurse, they just leave. They are not accountable. They just mark the vitals improperly and they leave it. But
yes.
when they enter the ward as a staff nurse, usage of mobile phone and proper documentation should be noted down.
Yes, of course, Kathy. We need to think about the mobile phone usage in our ward and ICU when you work as a staff nurse. So that is an area where you're going to treat the patient who comes with the pain, who are literally going to be alone for the next 5 to 10 days with you without seeing their family members, without seeing any television, without seeing anything else. So that is the area where we need to give space for the patient to live satisfactorily, and they need to undergo to the treatment and recover soon. And now we are stepping into the final version, Kathy, the rapid fire. I have three rapid fires to you and the single words from you. The one word that defines a nurse as a professional.
Um, Accountable nurse or a nurse with
Hmm.
proper integrity.
Okay, yes, right. So the next one is one habit every nurse should develop.
Continuing education.
Yes, where we learn
Lifelong
more
learning
things.
should be there. Then only you can be a good professional.
Yes, of course, Kathy. The final one is the one professional value you will never compromise. I'm asking you.
Confidentiality.
Yes, of course. We started this podcast from the word confidentiality and we ending with the same word confidentiality. Why? Because that is
Never
very important.
compromise with confidentiality because that is one thing I developed through the years and I will always follow it. I'll never compromise with my confidentiality. You can ask anyone, any matter which comes to me stays with me. I do not share it with persons. People will
Yes.
not know in that surrounding for sure.
Yeah, okay. That's a great character features of our Kathy, and she's maintaining confidentiality. As she's my friend, I know very much about her, and we have the same bond between us. If I say something else to the Kathy, she will keep everything in her heart, and she will not disclose to anybody else. That kind of the person she is. And happy that we are ending up this episode 7, Kathy. And thank you so much for being here. And next week, we will try to initiate our podcast live sharp by 7 p.m. in next Saturday. Thank you so much, audience. And this is VC, and there Kathy is sitting along with us, and we are going to ending up this episode. And happy weekend, and have a stay and blessed thing. Why? Because this professional life is not a word we discuss, and it is not the thing we are going to discuss and you learn it. It is going to be practiced by you each and every day, each and every moment. So that is where you can enhance your nursing profession. Thank you so much, everyone. Bye bye, Kathy, and bye bye, audience.
Good night.
Thank you.